All right, good evening everyone, and welcome to our special session for pre-CV bootcamp, where we'll be discussing tips and tricks for the first year of your fellowship. My name is Nadeen Faza, and I'm one of the structural heart imagers here at Houston Methodist, and I'm being joined by a group of amazing guests who will be giving you advice and helpful tips for your years of fellowship. We'd like for this to be interactive, so please, you can go to poll.ev.com, enter DEBAKEY, and post your question. Alternatively, you can text DEBAKEY to 37607 and text in your message. We're going to be covering various topics today, but make sure to also tune in this weekend to our CV bootcamp taking place this coming Saturday and Sunday. We have sessions related to heart failure, CAD, structural heart disease, EP, and cardiovascular imaging. It's my honor and pleasure to start by introducing Dr. Isaac T. and Dr. Stephanie Fuentes, one of our superstar cardiology fellows here at Houston Methodist. Dr. Isaac T. is currently an interventional cardiology fellow, and he served as a chief cardiology fellow last year. Dr. Stephanie Fuentes is one of our cardiology fellows who's EP bound, hopefully in a couple of years. Thank you for being here. We'll start by discussing how to thrive during your first year of cardiology fellowship.
Okay, so when you start your first year, you're going to be having many thoughts going through your mind. You're going to be in a new training venue. You're going to be stressing about internal medicine boards. You're going to be encountering higher acuity patients, and you'll be in charge of teaching other trainees. You're also thinking about subspecialty training, whether it be interventional cardiology or EP, and you may be wondering about imposter syndrome at this point. And then you also will be trying to juggle work-life balance. So we want you to know that you're not expected to know everything. Cardiology fellowship is 3 years long, and it'll be a long life learning as well. You're building up on knowledge from internal medicine that you already have. You are never alone. Attendings are always a call away. There's always your co-fellows and nursing staff that are always around to help you. In 2021, there are many options for education. You can rely on textbooks. There's guidelines that are on paper as well as in your phone apps. There are podcasts such as our Cardio Nerds, and there's Twitter and up to date. Find a strategy that works best for you.
All right, thanks, Stephanie. So, when everyone starts their fellowship, they're always worried about the career path, and the truth is, you have time. For me, I thought of doing interventional. I always wanted to do interventional for since third year of medical school, but I really love heart failure, and when I came here, I wasn't very sure. But what I learned was you don't commit to one career path. Take this time to immerse yourself in all the subspecialties and see what you like. It's okay to be undecided. Many end up changing their minds. Most importantly, talk with your mentors, your advanced fellows, recent graduates. See what the job market is like. See what the job is like as an attending, and then you can decide, with an informed decision on how you want to proceed. Your mentors are going to be really, really important. They're a vital source of support and guidance during training. And the most important thing to remember is you don't need to be limited to one person or one specialty. You can have multiple mentors that can address different niches depending on what you need the most. And that's not just in research, but also in your training. Make sure your mentor is interested. That's the most important thing. And use them to evaluate and gauge your performance through training in this, what I would call a friendly environment. But keep in mind that you must accept criticism and, from there, learn to make improvements. Subspecialty match is always a very exciting time. The recommendation letters, I think, are the most important thing at this stage of the game. You want to get feedback from both cardiovascular and non-cardiovascular faculty and ancillary staff, and this is how the recommendation letter will come about when your program director or whoever writes it. You want to avoid, most importantly, generic letters. So you got to choose your letter writer wisely. Don't just get someone who's a big name but you never worked with them, but rather, someone who you've worked with very closely, who can give you, real support. And this comes up in the letter, and it shows, when the letter readers read it, and it becomes very important. If you're deciding to stay at your home program, you want to articulate your interests early, let everyone know. Program reputation is always important, something that comes up, but don't be swayed by this. Research is also important, especially if it's a competitive subspecialty that you want to apply for. And then personal statement, and most of all for you, it's going to be the fit of the program, because every program will be different, and you'll realize that as you interview along. Research is always important, especially if you're interested in academic cardiology and pursuing subspecialty training. Again, mentorship is key, so you got to find the right mentor. For those of you who haven't done much research, you can start small with case reports and reviews and just work from there. The most important thing, I think, is to collaborate with other fellows, and that can be your co-fellows, can be your second or third year fellows, to get a paper written, to get statistics done. Like everything in medicine, it's always a team sport. And, you don't always have to be the first author, although you always strive to be. And I'll let Stephanie talk to you about the women in cardiology.
So for many, when you join cardiology is when you realize that there's not that many women within your vicinity. This was not the case whenever you were in internal medicine. So I would say embrace it. You're here for a reason, and diversity is going to help grow cardiology. Find a mentor or a role model that will help you guide through this process, and also become one yourself. Speak up when you notice a mistreatment or unfairness, and if you guys choose to have a family or expand your family during your fellowship, and this goes for men as well as for women, remember it takes a village, and don't be afraid to ask for help, and rely on your co-fellows as well as your co-workers in general.
All right, excellent. So the keys to success are not, some secret. You work hard, you make sure your patient comes first. Sometimes that can mean staying late, but we're here to take care of patients. That's the most important thing. Your attitude is everything. You are a role model for other trainees. We're talking about medicine residents, people who ask you for a consult. So you got to be nice to them. You got to teach them. Lean on your co-fellows. When I was a fellow here in my first, second, third year, I still talk to my friends who are doing cardiology over in Philadelphia, because they can be a source of support as well. So just keep that in mind. And of course, don't give up on your hobbies. It's important you have a life of your own as well. Some of the pitfalls we want to avoid, don't ever take shortcuts in patient care, because we're here to take care of them. That's our number one priority. Always communicate with the primary team and other specialties, and this holds true, in your training and when you become an attending. Never be hostile, and don't be that cardiology fellow who doesn't want to help the other team. They're consulting you because you need help. I know some consults don't always make sense, but embrace your role as an educator. Tell them why they don't need this consult, or sometimes they just need help with something, and be that person who can be there for them, and everyone will come to appreciate you. Your ancillary staff, especially the staff in the cath lab, for example, they're an extension of your cardiology faculty. So be a team player, work well with them, and you'll see everything in the lab will go extra smooth. And that sometimes is very important too. And they'll help you and they'll teach you, because they've been doing this for years, and we have so much to learn from them as well. And finally, attend your educational conferences. I know it can be busy when you're rounding, but this is where you're gonna learn the most. So the bottom line, and this comes up all the time, right? The three tenets of medicine: be available, be affable, and be able. There are always going to be good days and bad days, days where you tell your attending, the atypical chest pain is unlikely to be ACS. And then troponin comes back at 15. Many more days where you find your mind wandering blank in the middle of a crowded room when your attending's asking you a question, and you wish you are the patient. However, there are days when your program director will commend you on a job well done. Realizing that you're not alone in this experience is what matters the most. It's comforting to know that all first-year fellows across the country are going through the same thing. I went through the same thing. Your attendings went through the same thing. And this is totally doable. And with their help and your dedication in taking care of patients, you will become the cardiologist you need to be no matter where you are. Be gracious and appreciative of this opportunity to be a cardiology fellow. Don't give up on your hobbies. Be humble, and just be a great physician, and the rest will fall into place.
All right. Thank you so much, Isaac and Stephanie, for the great tips for first-year fellows. First year of fellowship can be exciting, intimidating. A lot of changes can happen. You're an internal medicine resident, and then you're the cardiology fellow taking care of cardiogenic shock, STEMIs, life-threatening situations every single day. And it's important to remember that there's a steep learning curve, and as you progress in your fellowship, you'll learn more and more, and you'll have more autonomy. There are no stupid questions because our patients come first. So when in doubt, at any point in your training, ask the question and ask for help, because that's how we learn and that's how we advance in our careers. We have a question from the audience. How do you deal with all the different resources and flood of knowledge? For example, Twitter versus textbooks versus the weekly journals that show up. What is the way that you use, Isaac?
Well, so I actually find up-to-date one of the most helpful things, especially in the middle of busy clinical rounds. But Twitter, you got to be careful. There's a lot of good stuff on Twitter. There's a lot of interesting angios, interesting echoes, but you must be careful of what you come on Twitter. It's not exactly peer-reviewed. I find the review articles on JACC journals to be the most useful. There are hundreds of topics on access and calcium scores. What do they mean? Preventative care, heart failure, guideline-directed medical therapy, and these review articles go through everything you need to know to take care of the patient, that is up to date and very concise. So I think I really like those. In this day and age, the podcasts are really good, Cardio Nerds, and you'll hear from them later. It's when you're taking a drive home and it's a 20-minute ride, it's always useful to have something up on the radio playing, and I find that to be very soothing and very educational.
Thank you, Isaac. And speaking of Cardio Nerds and the podcast, I'd like to direct the next question to Stephanie. You're one of the Cardio Nerds ambassadors, so tell us how that kind of enriched your training as a cardiology fellow.
Oh, it's a great experience because we get to collaborate with many other fellows from different institutions, and it's nice, delving into whatever topic. We were doing a segment on EP in ACHD, and for the episode we learned so much, and then we were sharing information with all different congenital attendings as well. And so it's been a great experience to participate, but also to contribute.
Awesome. Thank you. And one last question. How can you prepare for certain rotations, such as the cath lab where everything is new for an internist, or EP?
Ooh.
Show up.
Cath lab's not for EP. No, I'm just kidding. So showing up is number one.
Yes.
Be ready to learn. And like I said, be nice to ancillary stuff. They'll teach you a lot. They'll teach you how to prepare a table. They'll teach you what you need for access. You don't need to be a superstar in access. You're new, you can go there and learn. Your attendings will be there to teach you. Just remember that the patients come first. Don't be afraid to ask questions. So if you're unsure about what you're doing, you need to ask a question. And I think the most important thing is don't ever push a wire when you can't advance it. But yeah, just showing up and having the attitude of wanting to learn, and do extra things, not necessarily scut work, but helping the ancillary staff to prepare the table, and everyone will be ready to teach you what you need to know.
All right, thank you so much. So thank you, Isaac and Stephanie, for sharing your words of wisdom with the incoming first-year fellows. I'd like to introduce the Cardio Nerds. It's an honor and pleasure having you here with us virtually. Dr. Ahmed Goyal and Dr. Daniel Ambender are here with us. Dr. Goyal is an interventional cardiology fellow at Cleveland Clinic, and Dr. Ambender is an interventional cardiology fellow at Hopkins. They're the co-founders of Cardio Nerds, and everybody knows Cardio Nerds, but it aims to democratize cardiovascular education, promote diversity and inclusion, provide mentorship and sponsorship, and invigorate a love for cardiovascular medicine and science. And I think they're part of our daily lives at this stage, and we're very happy for them to be here to talk about their initiatives and their thoughts on virtual cardiology education in 2021.
Well, thank you so much for such a generous introduction, Dr. Faza. I'd like to thank you and the organizers for inviting us. It's such an honor for Dan and myself, especially because we have benefited so much from the boot camps that Houston Methodist has put up in years past. And Dr. Faza asked Stephanie Fuentes how cardio nerds and participating cardio nerds has enriched her fellowship experience. And I'd like to say that the reverse is very much true, that Dr. Fuentes' role and contributions to cardio nerds has very much enriched the platform. And I think that's the crux of the talk here in terms of the incredible contributions that fellows can have to impact the world around them. So let me just start off by saying how excited we cardio nerds are to join you all at Houston Methodist today. So the topic we were asked to talk about is virtual cardiology education in 2021. This is a broad topic. And we thought for the bootcamp and for the fellows, we would change this into a question to make it most impactful for incoming fellows. How to use virtual cardiology education in 2021 to maximize your fellowship experience. Right, Dan?
That's exactly right, Amit. And we heard about the 3 A's of cardiology or medicine from Isaac earlier. Well, we're here to introduce the 3 C's, the 3 Cardio Nerd C's, to help you succeed as a fellow in training and grow as an educator. So our first C is consume. And as Stephanie pointed out earlier, it's so important to build your cardiovascular knowledge base by consuming from the many resources that are available. So you can take out, some of your, let's say, traditional learning tools like textbooks, journals, lectures, meeting, conferences, and gain so much from them. And you can overlay them on some of the new age learning tools and resources like webinars, blogs, YouTubes, podcasts, and as Isaac mentioned, Up to Date as a great resource. So definitely delve into that. But as one of the astute audience members mentioned, how do you not go crazy with so many resources? And you really do need to make a game plan. Obviously, the scope of that is out of this talk, but it's just very, very, very important to figure out what type of resource works for you and then use that to build your cardiovascular knowledge base to help you take care of patients without going crazy.
Yeah, so consume, a very important C. And, they used to say that you should never let a sun set on a ruptured appendix. But here at Cardio Nerds, we say you should never let the sun set on a question or a curiosity you may have while taking care of your patients. So if something like that comes up, ask somebody about it, read about it, learn about it, act on it for the betterment of your patients, and then teach about it. But don't just stop at consume. You should try to contribute. And there are so many ways to contribute. From peer-reviewed journals, find mentorship that'll guide you in publishing in peer-reviewed journals. I would give a shout out to Isadora Metias and Naja Khan, who are Cardio Nerds Academy fellows and fellow and resident at Houston Methodist, respectively. And again, there are so many ways to contribute. On the right, this is just one example of the types of ways that fellows can get engaged with professional societies. So this is an example of the ACC Fit newsletter, which is a tremendous opportunity. The deadline for this, I think, was yesterday, but there are a lot of opportunities with every professional society to contribute in different sorts of panels and councils and whatnot. There are ways to contribute within podcasts, and we've at Cardio Nerds have been so fortunate to learn from our colleagues at Houston Methodist and other places. So as an example, on the left, with Drs. Peter Rothstein, Stephanie Fuentes, and Isaac T. teaching us about cardiogenic shock from RV infarct, with messages and teaching from Dr. Stephen Little and Dr. Kasi. And just released on the right, having this amazing conversation about the important role that IMGs play in our workforce with Dr. Bill Zogby in an episode that was led by Isadora Metias. You can also contribute with a variety of webinars and other engagements with societies and professional societies. So on the left here, this was a webinar we did in concert with the Pennsylvania ACC chapter in the FIT section, actually with mentorship from Dr. Noshin Riza, who will speak with us later in this webinar. But this talk about women in EP was led by Stephanie Fuentes. And on the right here was a webinar we did with the Texas State chapter on a very interesting topic, VT in Chagas disease, where Stephanie was representing us as Cardio Nerds. So as you can tell, we take a lot of pride in our academy, our Cardio Nerds ambassadors from the various programs and are big fans of Dr. Fuentes. And finally, at Houston Methodist, you guys have an additional and a unique opportunity. The YouTube channel, it touches so many people and has such a broad scope. I've learned so much from it. And this is a talk I remember that I saw Dr. Faza giving a couple of years ago. I remember exactly where I was when I was listening to it. I was interested in structural heart disease. And she said something talking about the newer TAVR valves that have these skirts to prevent paravalvular leak. And she said, if you want to be a trendy valve, you should wear a cute skirt. And I remember that even today, and as someone who's going to be a structural fellow next year, it's amazing the lasting impact you can have with virtual education.
That's exactly right, Amit. And I could not agree more. You don't underestimate the power that you have to contribute. And that leads us to our final C, create. Don't underestimate the power of creativity that you could bring to the field. And we realized this, and I'll share a personal experience, a personal Cardio Nerds experience to highlight how we found this power of creativity to be just so amazing and unlocking and really accessible for all. So we had, started the podcast, we released a couple episodes, there was a tremendous uptake, but we recognized very early on that we didn't just want to be 2 people or 3 people making podcast episodes. We really wanted to help create creators, so to speak. And so we founded the Cardio Nerds Academy, where fellows, residents, and attendings even come together to learn how to create amazing content in the digital space for digital asynchronous medical education, where we go through different blocks, covering how to utilize social media in the best possible way, short teaching beast mode type of video tidbits, creation of infographics, and journal clubs. So we'll just highlight a few examples of tremendous creativity. So in this slide, we have right heart catheterization created by Aoun through one of our Cardio Nerds Academy members. Just absolutely fantastic. Very much encapsulates what we need to know when we approach the right heart catheterization. And just to highlight some of the statistics he shared with us, when he shared this on Twitter, even after a reiteration, his total engagements were in the tens of thousands, where people were downloading, going to our webpage to assess, more details that he had put there for references. So he already made a tremendous impact. And we know from feedback from around the country that people have been incorporating this graphic into talks. And from the journal club side, definitely join us for our monthly journal clubs, which we promote on Twitter. So you'll see the next one coming up shortly. But every month we get together on Twitter with everybody, the cardiovascular world, to discuss trials that have changed clinical practice. And so here's an example of the Paragon heart failure trial. And this infographic by Naja Khan so beautifully captured her idea of what the trial was in design and outcomes. And she did this through the Cardio Nerds Academy, and it just was a beautiful expression of this trial. And again, just to show you the numbers of the impact that she has made, when we put on this journal club, we had about 5 million impressions and just 1,000 tweets. People were really engaged and using this beautiful infographic to learn about this trial.
So Dan talked about infographics and ways to contribute and create within journal clubs. And, tutorials are phenomenal ways to teach thousands of people, if you have some message. And so, this is an example of a tutorial about diversity and inclusion based on a conversation we had with Dr. Pamela Douglas that Isadora created that was very impactful. But, there are several examples of impactful tutorials, both within and outside Cardio Nerds. And so you wonder, what kind of impact are you actually having? And so Tommy Das, who's the program director for the Academy, is actually studying these, through the Cardio Nerds tutorials. And so when we pose the statement, I feel comfortable with X topic, the topic of the tutorial. Before the tutorial, less than 30% agreed. But after the tutorial, over 75% agreed. And then at the end of the tutorial, when posed the statement, I learned something in this that may change my clinical practice, over 85% agreed. Now, there are a lot of caveats and issues with taking people's self-perceptions, but these are, very positive and important signals to take in mind. And so, the point of all of this is, as a fellow, as a trainee, you can have tremendous impact, but that impact can be positive or negative. So, like Dr. Isaac T said earlier, with social media, there are caveats. It's not peer reviewed. And so, on the viewer side, you have to be a discerning audience, but then on the creator side, we have a tremendous responsibility to create good content. And so this review by Dr. Purvi Pravani, Martha Gulati, and colleagues is wonderful. And I would direct you to the bottom right, the cautions. Do not discuss specific questions with patients. Refrain from discussing controversial topics. Never post HIPAA identifiable information. And I'll repeat, we have to protect our patients' privacy. And also avoid posting content that may be negatively viewed. I'll add to that, when you're creating and educating, to be very careful and double check, triple check the content you put up. Have somebody you look up to, a mentor who's an expert in the area, review your content. Because when you speak on Twitter or other online places, you're representing yourself and your institution. And so make sure that you also look at your institutional policies related to this.
And so again, those 3 C's, consume, contribute, and create, are really, really great tools for you to succeed as a fellow in training and grow as an educator?
Words of wisdom for general cardiology fellows beginning fellowship. But Dan, these aren't just any cardiology fellows. These are Houston Methodist first-year cardiology fellows. Bharat, Smitha, Victor, Isadora, Salim, they are the cream of the crop. So they may be prepared for a 4th C. What do you think?
I'd wager that they're up for the challenge.
Okay. So the 4th C for you guys, we challenge you guys to take something that you learned from the upcoming Houston Methodist boot camp this weekend and create a tutorial. I included a link from essentially a how-to guide that I wrote for the acc.org fit section on how to create a tutorial. And if you want to take us up on it, then I welcome you to get in touch with us. We'll walk you through it, give you our template, review it, help you review it, and then promote it with you on Twitter and our website. So for the 5 of you and everyone else out there, congratulations for beginning what I think is the best ride of life. And thank you to everyone at Houston Methodist for putting this together.
Thank you for having us.
Right. Thank you so much. That was a fantastic presentation and an overview of your initiatives. And I'm going to start by a question of my own. What inspired you to create CardioNerds during a time of fellowship that I know must have been busy? What inspired you, and how did you find the time to do all these great things?
Dan, do you want to take that?
Absolutely. So Amit and I, we met in residency at Hopkins, and we just loved teaching each other about cardiology, and we just loved teaching our residents and eventually as fellows, just growing in this teaching space. But we recognized that there are limitations in terms of how much we could teach, and so we basically were inspired by our mentor, Rezaman Nash, who was part of the Clinical Problem Solvers, to think about how we could use the digital space for medical education. And we won't go through the entire trials and tribulations of starting the podcast, but we said to ourselves, if we can make a small impact, this is going to work. And let's try making one episode. And we made one episode together, and it was just such an amazing blast. And and the people that we started working with, like Stephanie, Isaac, and Isadora, and just the list goes on, just really inspire us to keep going. And we're basically working full time, fellows by day, CardioNerds at night, but and our spouses are just so loving and accepting of this for some reason. But that would be my take. Amit, do you have anything to add?
I would just add that there was that initial bolus of inspiration from Reza and the Clinical Problem Solvers, but I think the next big bolus came from the CNCR series we did with the FIT section, really with a lot of support and collaboration from Dr. Noshid Riza, where we work with fellows from these different institutions. And for the first time, we were meeting a lot of the audience, but we were working hand in hand with incredible fellows from all these different places. You saw the folks here from Houston Methodist. And we realized how incredible this community is. And that's really what made us grow from a podcast to, had the ambassadors, the academy, because the more colleagues that we met, the more we wanted to work with.
Thank you so much on behalf of the cardiology community across the nation for the amazing podcast, for bringing us all together, for enriching our educational experience. And thank you for being with us today. I encourage all incoming first-year fellows to join the CardioNerds and engage and create content and be part of the medical education. Thank you so much, CardioNerds.
Thank you.
All right. Again, it's my honor and pleasure to introduce our current Chief Cardiology Fellows here with us today. As an Associate Program Director, it gives me great pleasure to work with them. I'm inspired by their plans for the program, the way they interact with the fellows, the way they plan the educational and social activities. So I'm very excited that they're here with us today to go over tips for night call. As you know, being on night call as a cardiology fellow can be intimidating, but Dr. Aoun and Dr. Salil Kumar will share some very helpful tips for you all.
Well, first of all, thank you guys for having us here today. And we've been downloading episodes from day one, and we've also been listening to the episodes as well. And it's been an incredible journey to see you guys and how far the podcast has come. I definitely listen to podcasts on my way to work and back from work, depending on how busy the day has been. So we're going to go over some tips on how to survive call. We do have a disclaimer. We both just recently finished our last calls for fellowship, and we could not be more ecstatic But we still remember how terrifying it was on day one. So on your first day, you're not expected to be Michael DeBakey himself, but eventually, hopefully, by the end of your career, you'll have come close to learning enough to match up to the reputation of the DeBakey Heart and Vascular Institute. So on the first night, as Isaac and Stephanie have said, you aren't expected to know everything. It's absolutely impossible. It's a journey that will require 3 years of learning, and it'll come with a lot of trials and tribulations, to be frank. The most important learning that does happen is overnight. It's about one of the only times in fellowship that you're alone and by yourself, and you're making decisions. You are the eyes, the ears for your cardiology division, helping to protect the patients overnight and helping to triage them for the entire department. So it's something that you shouldn't take lightly. It'll be terrifying, but it'll also be extremely rewarding by the end, especially by the time that you're done. And so yeah, call is hard. It will get better. We promise.
All right, so first thing, I mean, there are plenty of things that you should know before you start, but at the same time, you're not expected to know everything. A few tricks from us to you guys. One, you should be familiarized a little bit with the devices that cardiac patients have. And we're talking about electrophysiology devices, so ICDs, pacemakers. I would encourage you a little bit to get to know them on a chest x-ray first, and then later on try to start learning how they function and how to interrogate the device. From a practical standpoint, I think it's also important to know in the hospital where are the interrogator devices. So there might be on the same cardiac unit, there might be on a different in a different building. So definitely look into that. Be friends with the reps. So the reps can help you a lot on, they can teach you how to use the device and how to interrogate the device, but they can also teach you how to change few of the settings of the device. Like as for example, if you wanna overpace an arrhythmia or diagnose someone who came in with a syncope, for example. I think that's the first trick. Sal?
So the next piece of advice is learn, and if you guys haven't learned already, how to do point of care ultrasound. It's amazing how just a couple of views by the bedside ultrasound can help you narrow down a differential diagnosis and help you figure out what might be going on. So learn how to determine whether or not somebody has a large pericardial effusion and they're in tamponade. Learn how to figure out if somebody's EF is grossly abnormal versus normal, and then also being able to tell someone's fluid status is also a very valuable skill, especially when you might not know what's going on. It gives you a first step into what might be going on.
The third trick is actually learn about mechanical support devices. So it depends on the program that you're training in. If your program does a lot of transplant, does a lot of mechanical support devices, you definitely should get familiarized with how, where would they be inserted, for example, how to look at a normal curves that, for example, in a balloon pump, in an Impala, understand the position of a balloon pump, understand the position of an Impala. And of course, since Sal was talking about the POCUS, you can also learn where you can find that Impala device and the parasternal long axis and do the measurements and all of that early on. If your program is does not have a lot of mechanical support, then that trick might be for later on.
I think one of the most important parts of call is developing a system. So when I say develop a system, I mean when you get a consult, have a systematic way that you're going through the chart and being very focused. You're no longer a medicine resident, you are a cardiologist. So go through the last echo, go through the last cath, look through previous stress testings, maybe look through the last previous note, and then go into that consult with knowing exactly what the question is and how you're going to answer that question. And then also an important part is having a way to track all the new consults you're getting, keeping another list for patients who you need to follow up on overnight, and then keep following up over and over and over again. That's the key to success and key to making sure that your patients are doing okay overnight. If you do things systematically, you will succeed, but the first couple of months is about learning what is your system and talk with your upper years to find out what system can work best for you.
The next point would be actually looking into the cath lab, how to activate a cath lab. First, before that, where is the cath lab? Which floor is the cath lab? These are basics, and definitely ask your senior fellows. So after you know where is the cath lab, the next question to your senior fellows is when to activate the cath lab. Definitely when a patient is sick with a STEMI, for example, or when a patient has a cardiogenic shock and a mechanical circulatory support needs to be inserted. And the next thing to know is the practical stuff. How to activate the cath lab. Should I call the operator? They will page the system. Should I call the interventional fellow? Should I call the attending, the interventionalist on call? All of those are very important to know early on because you never know when the emergency happened.
The next, one of the most important things I think is nutrition. And so on call overnight, it's very easy to get your Burger King or get your Wendy's. But to me, my best call nights are when I bring in some like healthy salad or snack. And at 3 a.m. in the morning, it's hard not to Uber eat something that's very greasy and bad for you. But I think nutrition goes a long way when you're on call.
Yeah, I mean, going to that point, I think it's very important to look at our pictures 3 years ago and our picture now. We look different. And it would depend on the state that you're in, of course. The next point that we're going to talk about is actually asking for help is never a weakness. I really think that I can learn from the intern, I can learn from the nurse, I can learn from the medical student, I can learn from the attending, and I can learn from myself. I've learned a lot from my peers and co-fellows than I've even sometimes learned from attendings just because they faced the same situations, the same struggles as me because they were in my shoes. So definitely ask them, ask your senior fellows, ask everybody to point you into the right direction.
To piggyback off that, I think the more that I go in training, the more that I learn how much I don't know. And so asking for help and asking for help from other subspecialists is super important. The next point is don't lose your compassion. It's easy your first year, 6 months in, to lose your way and to get mad that you've gotten your 10th consult and that 10th consult could be for AFib, but that's a patient who needs your help, and it's important to keep that in mind and try to find a way to center yourself throughout fellowship so you try not to lose that compassion.
Our last point, but definitely not the least,
Second to last, I'm sorry. Be kind to
your team. So you definitely are going to work a lot with nurses. You definitely are going to learn a lot with nurse practitioners, with residents, with medical students. Be kind to them. You never know when they will be able to help you. Sometimes you're going to be overwhelmed seeing very sick patients. They might be able to just actually smile to you, and that smile is helpful. So definitely be kind to your team.
And then finally, family is everything. So your fellowship family will help get you through to the end. 2 years later, 3 years later, finally being done with call. When you're on call, your family at home doesn't get to see you. They don't get to be with you. They miss out on holidays with you. They miss out on weeknights, weekdays, weekends with you. And so it's very important to understand that this taking call it affects your family and everyone around it. So appreciate them every day. That's the most important part.
So this picture actually was taken in the cardiovascular boot camp a couple of years ago when we started. And we're very excited for this weekend actually to be giving some sessions there and to contribute. And I mean, we learned a lot during our training. So you guys are going to get there and you're going to succeed.
All right, thank you so much, Chiefs. Can you share any memorable moments from your first night calls as a first-year fellow?
It's very tricky. Well, I remember on not my first, maybe my second call actually, I was called about a patient who had his impella not functioning. And I was like, okay, I know where's the impella. I'm like, sure, I go there. I look at the patient, assessed him hemodynamically, everything's good. And then no matter what I do with the Impella device, I change, well, it's not working. Gave a call to my attending, and then we worked it out. So no matter what, nothing happened, and I had to activate like the cath lab on that call, which was my second call, and it wasn't really easy to do. So I had to learn all of that in one night.
All right, Sal?
I think the moments I remember most are when you get a patient in cardiogenic shock who just walks into the door, and then you activate the cath lab, and we have the ability here to put in balloon pumps bedside. So doing those procedures at the bedside, carving time out when you're on call to take care of these really sick patients and be hands-on, and then seeing them throughout the night and seeing them get better is an incredible experience.
Beautiful. Thank you so much for sharing your advice, and again, I'm very honored to be working with you, and I look forward to a very productive year for us and our program.
Thank you.
Thank you.
All right. Dr. Nadeen Riza, how are you today? It's so good to see you. Dr. Riza is an assistant professor and translational researcher at the University of Pennsylvania, focusing on advanced heart failure and transplant cardiology, cardiovascular genetics, and phenomics. She's an active leader in the Heart Failure Society of America, American Heart Association, and American College of Cardiology at the local and national levels, and volunteers on multiple leadership councils and steering committees within these organizations. She's made significant contributions as the ACC FIT section chair last year, and she's been very active in research and has published in high-impact journals. So I'm very excited for her to share her journey with in research with all of us today.
Thank you so much for that very kind introduction. Let me share my slides here. All right. So again, good evening, everyone. My name is Nadeen Riza. I'm assistant professor in the Division of Cardiovascular Medicine at the University of Pennsylvania. My thanks to Dr. Faza, the entire DEBAKEY CV Live organizers, for the invitation to speak with you all for a few minutes this evening on jumpstarting your research during fellowship. I'm so delighted to be here and to be alongside my friends and colleagues, Dan and Amit and Poonam. So here are my disclosures, and perhaps my most important disclosure is that my advice is coming from my N of 1 experience. This whole topic could easily be an hour-long lecture on its own, but perhaps the most important advice that I can give you if you're interested in a research career is to talk to as many trusted mentors and colleagues as possible. And it's important to know that even as a first-year fellow, it's not too early to start these conversations, and don't be afraid to start these conversations at any point in your fellowship. Fellowship is a wonderful time to explore the breadth and depth of a career in cardiovascular research. And we are very fortunate to be in a field where there's groundbreaking work being performed every day, all the way from basic science to the clinical implementation ends of this spectrum. There's no shortage of questions that need answers. Perhaps the most important step for you to take if you're interested in a career in cardiovascular research is to find where your passion lies along this research continuum. Are you interested in bench research, working with human subjects, becoming a clinical trialist, or in implementation science? Figuring out what really and truly excites you about a career in investigation is really the foundation for all of these steps that will come after. So if you're new to research, the whole concept can definitely seem overwhelming. So I distilled your to-do list for fellowship down into these 5 tasks. And I feel like that's a theme from our speakers today, really distilling everything down into a few key points. And here they are. Read, write, identify your mentors, something you've already heard a few times today, learn a new research skill, and develop your EQ. So let's go through them. Number 1, read voraciously. And I think you've already heard this from the cardio nerds when they were talking about consuming. So my advice is to read journals, both inside and outside your primary area of interest. You really want to get into the primary literature. This will help you identify gaps in the field and opportunities for future investigation. It also helps you identify authors whose writing styles you like and may want to emulate. And it helps you learn as well how researchers successfully communicate their work to others. In addition to reading journals, get on cardio Twitter, again, a theme you've already heard today. So many of cardiovascular medicine's leading scholars are on Twitter, regularly sharing their insights in their work, the work of others, and their thoughts on the future directions and needs of our field. Number 2, write voraciously. The first thing you write, again, as you've already heard today once, does not have to be original research. Case reports, abstracts, reviews, editorials all provide their own skill-building benefits and are great opportunities for you to develop your writing skills and your critical thinking skills. Number 3, identify your mentors. Not a topic I can comprehensively cover today, but regardless of what kind of research career that you're envisioning for yourself, you will need a team of mentors. Realize that the mentor-mentee relationship is bidirectional and needs to be nurtured to grow over time. When you're considering your candidate slate of mentors, check out their track record of mentoring. See what their mentees are up to now, and if their career trajectories are like the one that you're envisioning for yourself. Number 4, learn at least one new research skill. If you do not have any formal training in research methods, but you're committed to a career as a physician scientist, you should seriously consider enrolling in an advanced degree program, like perhaps a master's in clinical epidemiology, translational research, or health policy, as a few examples of ones we have available here at the University of Pennsylvania for our cardiology fellows. You don't have to wait until your fellowship research years to get started. There are many free online resources for learning coding and programming skills, statistics skills, which you can do as your free time in fellowship allows. Number 5, develop your emotional intelligence or your emotional quotient or EQ. It's just like clinical medicine, science is not an individual sport, and your research and your career will benefit from having a kind, collaborative growth mindset. Okay, so you're probably thinking now, how do I have time for all of that as a clinical fellow? As it turns out, research can come in many forms. Here are a few tips to get you started. So you can start by asking attendings at your institution who specialize in your area of primary interest about any ongoing projects they have with opportunities for collaboration, or things like becoming a junior investigator in an ongoing clinical trial with one of your site PIs, for example. You can take the lead on becoming the primary data generator or building or maintaining a single center registry for a disease process or an intervention of interest. You should also learn to interface with your institutional data analytics center and find out if you have access to bioinformaticians, biostatisticians that can help you with any potential projects. Outside of what is available at your center, here I wanted to show you a few existing databases like those from our professional societies to help you answer hypothesis-driven questions. So here on this slide, I've listed just a few examples and some sources of data that fellows, either through submitting project proposals directly through these portals or to our professional societies, have had previous success with in creating research careers. So just sort of going point by point here, the National Cardiovascular Data Registry, or the NCDR, is the ACC's cardiovascular suite of registries through which the data that is used and generated helps hospitals and private practices measure and improve their quality of care. There are limited data sets that are derived from the NCDR that are available for research, and you can learn more about how to submit a proposal and potentially gain access and do a project on the NCDR website. The AHA Get With the Guidelines program is another quality improvement program that collects data on patients admitted to more than 2,400 nationwide hospitals, mostly patients who present with atrial fibrillation, heart failure, stroke, cardiac arrest, and most recently, COVID-19. Hypothesis-driven studies can also be proposed through Get With the Guidelines with an application submission. Government and administrative databases, including the national or nationwide inpatient sample and claims databases using Medicare or commercial insurance data, may also be available through your mentors. And there are also national patient level registries. For me, I'm in heart failure, so what comes to mind for me is UNOS and the SRTR registries regarding organ transplantation. A quick word on funding and time. If you're planning on pursuing a research career, you will likely be taking a grant-funded pathway through the NIH. Here, I'm showing you a really nice central illustration from a comprehensive manuscript on the early stage cardiovascular physician scientist that was published in the Journal of the American College of Cardiology in 2015. This figure, and where I'm highlighting specifically, denotes where you all are in this pre-K award period as new fellows. And then just to drill down again on these suggested strategies for success during fellowship. So if you're interested in this pathway, you should carve out protected time for research, identify your primary mentor and additional mentors, initiate small projects and learn the research process, learn to write well from mentors and from writing workshops or other resources, produce first author papers, and then gain introspection and clarity on the future directions you want for your career. If you want to become grant funded, it is in your best interest to become familiar with the NIH Funding Pathways early. You may want to express interest in a spot in your program's T32 training program if your program has such a program, specifically for your fellowship research years, which can help you build momentum towards a K08 or K23 application, which is the NIH Career Development Award. This slide is showing you the temporal training pathway going from, as you can see, medical student all the way to faculty. And aligned on the right are when you may expect to apply for the various career development awards on your pathway to becoming an independent investigator. This is another table from that sample manuscript I mentioned in JAC, and I'm not going to review this in depth, but I wanted to let you know that it's there for your reference if you need it, and to let you know that fellows can be well positioned to apply for K awards towards the end of fellowship. The earlier you start planning, the better. And again, the most common awards are a KL2, which is what I'm currently on, a K23, or a K08. In addition to the NIH-funded pathway, there are many other funding sources for fellows who are interested in research. Again, more examples from that manuscript here listed in the table, including the AHA Fellow to Faculty Transition Award, the American College of Cardiology's Foundation Merck Fellowship Award in Cardiovascular Disease and Cardiometabolic Disorder Research, the Doris Duke Charitable Foundation and Burroughs Wellcome Fund Awards, separate institutional pilot awards, which you should look at definitely for your institution, and those from related foundations like the American Diabetes Association and so forth. In addition to those, there are also industry and investigator-initiated research grants, funding from government agencies like the Department of Defense, the Veterans Affairs Medical Centers, and PCORI. And then, of course, philanthropy is another potential strategy as well. So there are many resources to help you along this research journey, and I don't have time to get into all of them today, but I've shared just a few conceptual resources for you to consider if you're interested in this path. You can certainly look into sessions like these about bolstering your skills as a clinician investigator. Many of them are now happening at scientific meetings, both in person and virtually. There's certainly been a growth in the number of these sessions that are geared towards helping fellows and early career investigators develop their scientific writing and presentation skills. This is actually a photo from one such session we had at the American Heart Association Scientific Sessions in 2018. There are many webinars available on these topics from our professional societies. It seems like a new one a week coming out on these topics. Here I'm just showing you a representative image from a recent webinar that was hosted by Dr. Bonnie Key, the editor-in-chief of JAC Cardio-Oncology, on how to develop a multidisciplinary clinical research career, and this is available and archived for viewing through the ACC. There are additionally online and in-person courses. Some of them I've already mentioned and you've already heard, but just to name a couple popular ones out loud, the American College of Cardiology annually holds the How to Become a Cardiovascular Investigator course, which is a great springboard for fellows interested in careers in research. And again, online resources like DataCamp, for example, if you're interested in bolstering your statistical, programming, or coding skills, again, free online to enroll. You should also keep an eye out for announcements for extramural programs like the CVCT internship, CVCT standing for cardiovascular clinical trials here. And they have a fellowship for young trialists. So if you're interested in becoming a clinical trialist, it's good to get involved with this organization and watch out for their calls for nominations for opportunities. I hope you now feel a little bit more prepared to jumpstart your research careers. Congratulations and welcome to cardiology. Please don't hesitate to reach out anytime if I can be of assistance on your journey. Thanks so much.
Thank you so very much, Dr. Riza. It was very helpful to, I think, fellows and early career cardiologists as well. It's good to know what resources are out there and how to have a kind of a roadmap to jumpstarting one's research career. I have a question from the audience. How do you find the right mentor? What are the qualities you look for in one?
Yeah, that's a wonderful question. And I think something that fellows, anybody who's interested in a pathway in which research or clinical investigation is one, but really you can think about, you need sort of mentors, I think, to grow as a cardiologist in general, whether or not you're interested in a career in investigation. So I think the first question you have to ask yourself is, what do I need a mentor for? What exactly am I looking for? Am I looking for a mentor who will give me a research project? Am I looking for a mentor who's involved in clinical trials? Am I looking for a mentor to help me with life issues? Am I looking for a mentor to help me develop my structural echo skills? The list can go on. So I think the first question you need to ask yourself is, what do I need the mentor for? And then I think the second thing you need to do is really take an introspective look at yourself and say, what are the skills that I have? And what are the skills that I need to advance to the next stage of where I want to be for my career? I think once you sort of have answered those two questions, you obviously can look around your local environment and see who really meets the skill set that you need for what you want to accomplish, and really start from there. I think another wonderful aspect of sort of the world that we live in is that mentorship doesn't have to be local anymore. Many of my mentors who I now collaborate on with various research projects are not here at my same institution, and I've struck up relationships with them either through previously meeting in person at scientific meetings, through Twitter, honestly, for a lot of these relationships. So always keep an open mind about where this pool of mentors can come from. And then I think once you've sort of established what you need as a mentor, what you want, and sort of where you want to go, then you can, again, as I mentioned, have a broader look at who is around you that can fulfill those needs for you. And then we get into some of the more nitty-gritty things that I think you've already heard from some of the folks here today about availability. A couple of things that I mentioned in terms of looking at the track record of the mentor and how many mentees that they have and what those mentees have gone on to do. And if you see that the mentor has a great record of taking on young fellows, developing them into whatever kind of investigator that you're interested in becoming, those investigators then sort of graduate, go on to careers of ones that you can see yourself in. Those are, I think, all marks of somebody that can take you to the place that you want to go. But I do think it's important to emphasize that you're not going to find one person who can do it all for you. And so it really is in your best interest, I think, to diversify your portfolio of mentors and really make sure you have a mentorship team invested in your success.
All right. Thank you so very much, Dr. Riza, for being with us today. And thank you for all your contributions to the community of cardiology fellows this past year. And we appreciate your words of advice. Research can be very tricky, especially in your first year of fellowship, but I think, as you mentioned, if you have a plan and you know the steps to advance and progress, it is definitely doable and can have an impact on your future career. So thank you so much for being with us today.
My pleasure. Thanks again.
All right. We're going to move to a very important topic that definitely needs to be discussed at this stage, which is fellowship, well-being, and avoiding burnout. Yes, we're all very excited. We're starting our careers in cardiology. Yes, we've talked about how exhausting, intimidating, rewarding it can be, but it's important to remember that your well-being comes first. So I'm very excited to introduce Dr. Poonam Velakapudi, who is a structural interventional cardiologist and an assistant professor of medicine and associate program director for the cardiovascular medicine fellowship at the University of Nebraska. She's currently the chair of the ACC Early Career Section and the co-chair for the Society for Cardiovascular Angiography and Interventions Educational Committee. She's a strong proponent of using social media for fostering education in cardiology and serves as a social media editor for JACC Cardiovascular Interventions. She's also the associate editor for European Heart Journal Case Reports. A few years ago, she was the ACC FIT section chair and had worked with fellows closely. We're very happy she's here with us today to share her words of wisdom with regards to well-being and avoiding burnout.
Thanks for the introduction. That was great. And thanks for inviting me and having me speak today. So I'm going to talk a little bit about burnout and then touch upon well-being as well. So it's not been very long since I graduated. I finished my fellowship about 3 years ago, and I've been faculty for 3 years. And I realized that it's really important that we understand early on in our fellowship about how important it is to foster wellness and well-being and identify burnout early and prevent this. So the objectives of my presentation would be to review the prevalence of burnout among cardiologists and trainees, explore the risk factors, causes, and strategies to address burnout, learn how to promote well-being, and be aware of available resources for these things. So let me start off with, just my own experiences. So when I wake up in the morning, there's multiple things that I know I have to tackle. For example, emails. We always wake up with emails. We think about how our day is going to be with our clinic patients or patients that we are going to cath, etc. Then we have home responsibilities and then lectures and our own well-being stuff like exercise, eating healthy, and things like that. So we always, plan well ahead of time and think everything is going to be smooth, but through the day, this is what it ends up being on many days. And so you end up being burned out if you don't plan well, and if you start saying yes to everything, this is what's going to happen. So this is just the prevalence of burnout on a recent survey that was published. So the Professional Life Survey, this was emailed to about 10,000 physicians and completed by about 20% of them. And there was an additional mini-Z survey that was completed by about 2,000 cardiologists and fellows in training. If you look at this, there's various reasons for burnout or stress, and on the x-axis, and then across, you can see symptoms go from stress to being completely burnt out. And it was noted on this that mid-career cardiologists and women are more burned out as compared to the others. About 39% of mid-career cardiologists are burnt out. Now, fellows in training as well, about 10% experience burnout. And overall, about a quarter of US cardiologists reported feeling burnt out, and nearly half reported being stressed. And so it is important that we know this data, because this is what helps us take action and mitigate these difficulties of burnout. So about 4 out of 10 cardiologists are burned out. This is a Medscape survey, which is more broader, and you can see that it's somewhere in the top of the professions of within medicine of people being burnt out. Now, what is burnout? It's important to understand this is characterized by a loss of interest in work and depersonalization. So not good, particularly if this happens during training. You have a long career ahead of time. So it's really important that you understand what it is and recognize early. Now, this is a survey that was done in 703 physicians, asking about to what extent physician burnout was a problem at their institution. And about 35% said it was a serious problem, and 48% thought it was a moderate problem. So this is indeed a problem that's prevalent. Now, it's important to understand that stress can be a predisposer to burnout. And so understanding these differences and learning when early on about this may prevent going into the burnout stage. So during stress, emotions are overreactive and there's urgency and hyperactivity, whereas in burnout, emotions are blunted and there's helplessness and hopelessness. There's loss of energy, and stress leads to anxiety disorders, and the primary damage is physical, whereas in burnout, there's loss of motivation, ideals, and hope, leads to detachment, depression, and the primary damage is very emotional. So it's really important to understand where one is on the burnout curve if you're not interested in doing things that you normally are interested in doing. So it starts from, being overworked, excessive expectations, hard work, low reward, and then goes all the way down to collapse. So it's important to understand and identify early on before you reach the end of this curve. So there's plenty of risk factors for burnout, and particularly in our profession, if you're just starting off cardiology fellowship and you're aiming to do further fellowships, it's a long training ahead, and so it's important to understand that this needs to be mitigated early on. There's financial responsibilities. There could be the demand mismatch causing overworking situations, and there could be academic dissatisfaction where you're doing a lot of clinical work and not doing other things that you want to do. And some can even take on administrative burdens, which will add on. So there's several consequences, right? It's not without ramifications. So if a physician is burnt out, there's going to be decreased quality of care. There's going to be increased medical errors, decreased patient satisfaction. There's decreased productivity, increased turnover, and increased costs. And there's other things that are much worse, such as broken relationships, depression, suicide, and abuse of substances. So a survey again in MedGive showed that only 23% of the cardiologists actually considered professional help. And this is one of the most important things that I want to point out is normally physicians tend to take things very, tend to take on a lot of things and do not report being stressed or burnt out. And hence, in physicians, females have about 130% higher than general, compared to general female population. The suicide rates are much higher. And so is with men, 40% higher than the general population. And so how do you identify burnout? There's a lot of ways, surveys. There's an American Psychiatric Association survey. There's a Mini-Z survey by AMA. So there's plenty of ways to identify, and it's important to make use of these surveys to identify if you need to evaluate oneself. And then on the other flip side is wellness. If you don't maintain wellness or well-being and you're always working hard, you would end up, not being happy. So it's important to find joy and meaning in your life and work with an improved experience of providing care. So if you're happy with your personal self-care and what you're doing in terms of wellness, it shows in your work. So it's important to deal with burnout. I call it the three-prong approach. This is not from me, this is from the web. So recognize burnout. So watch for the warning signs, if not just among yourselves, but among colleagues as well. Important to reverse, undo the damage by maintaining, by managing your stress and seek support when necessary. So it's really important. I cannot emphasize how important it is to ask for help and for support when you need it. And build your resilience to stress by taking care of yourself, both physically as well as emotionally. How do you prevent burnout? Just as a first year, starting off in your fellowship, you can start, your days are going to be busy. There's going to be a lot of learning, lots of things to do. And you might get lost if you don't have a well-planned day. So start your day with something relaxing, write or read, do exercise, anything that, you love to do. Adopt a healthy eating and exercising and sleeping habits. Sometimes it's hard with call schedules being crazy and you never know how it's going to be, but make sure you eat right and participate in exercise or some other activities. And when you're not on call or when you have time, it's nice to get plenty of rest when you can. And set boundaries. You may think you're an early career, you're in a, just at the beginning of fellowship, you have to say yes to everything. That's not necessary. You need to work hard and do and fulfill your responsibilities. But outside of that, I think you can decide and set boundaries and only take on things that you are interested in and will help you advance in your career. Now, it's important to take a daily break from technology, which we are always so addicted to our phones, to our emails, and etc. But it's important to set that time aside for yourself and not, detach from these things that will take all your time away before you realize. Nourish your creative side. So find a fun project to do, find a favorite hobby or something that you can do outside work, and then learn how to manage stress. This is the most important thing. When you're on the road to burnout, you may feel helpless, but managing things well and asking for help can overcome that. And there's various ways to maintain self-care and wellness. You can maintain the sleep hygiene, meditation, mindfulness, yoga, exercises, relaxation. There's plenty of ways. There's resources both online as well as from societies. So I was actively involved. As a fellow in training, in the training section, I'd just transitioned to an early career, and so did work with a wonderful group of ACC members on a wellness work group, and I created a nice burnout toolkit, which was on the webpage, as well as we authored this and paper in JACC, which we talk about various ways to foster wellness. So one of the most important things is to create positive learning environments. And, this is important during fellowship as well as in our training, and ACC has helped foster this through various chapter meetings and annual scientific sessions. For example, I attended a leadership meeting where we actually did yoga within the meeting. So great ways to promote wellness, not just at our institutions, but at the societal level. And then there's important other things that we can do is, provide support to clinicians, students, invest in research, and all these other things that I don't want to dig into at this time. I want you all to know there's a lot of resources if you're interested in well-being. There's this burnout infographic that ACC has put out as well. And so this is just from one institution, but there's plenty of other institutions that work hard on promoting wellness as well as understanding and preventing burnout. So in short, I would like to say it's important to identify and prevent burnout early, particularly important to seek help when you need it. This is very, very important. Your colleagues or your faculty or whoever you're working with, it's very important that you seek help. Do things that you enjoy outside of work to promote your wellness. And there's various resources that are available both at the institutional and societal level. And so make use of these resources and reach out to folks for these resources. So thank you. And I really want to thank DEBAKEY and Dr. Faza for inviting me today.
Thank you so much for a very important and very helpful talk for first-year fellows and fellows in general. And thank you for sharing the resources. I think there's more out there than we know of, and it's important to go and read about it and take it seriously. It's as important as your rotations. Your well-being is as important as your career, and the only way for you to take care of others is to take care of yourself first. Dr. Velakpudi, reflecting back on the past year, it's with the COVID pandemic, it's been particularly hard for fellows with dealing with burnout, relative social isolation, and it feels like we're going from one surge to the next. What words of advice do you have for fellows this year as they're about to kind of embark on a new surge of COVID-19?
So what last year has really taught us is to be resilient and take on things in a very unplanned way. And a lot of fellows and trainees and early careers have really done a great job in overcoming all these, difficulties in a very positive way. But we also have to understand that not in unusual on a regular day, you always have other people that you meet outside your institutions, or you may be able to travel, meet family and things like that, which help you mitigate the stress. But this was completely lacking last year. And so, but what really helped was a lot of virtual conferences or virtual meetings, which were more than, frequent, I would say, which gave an opportunity for people to connect with one another. And then institutions have done a great job about making sure that there are, ways or resources were made available to trainees. For example, we had interviews, people could not visit, but we did make sure that there were ways that candidates could reach out to us, and then we could answer their questions in a very detailed way. So we had, after the fellowship interview, we had a great match, and we have a wonderful group of fellows that have just started, and these people hadn't even met us in person or come here in person. So, I think what we have learned is that, we were very resilient, and we have done what we can in terms of in a really difficult situation. And I think, going forward, it will be really these characteristics will help us, excel in what we can do in our future careers. So.
Thank you so very much for addressing a very important topic, and we hope we can have you here in person as soon as this pandemic is over. Thank you so much for being with us today.
Thank you so much for having me.
Thank you. All right. Thank you to all our guest speakers and our cardiology fellows and chief fellows for addressing important topics related to the first year of cardiology fellowship. It's an exciting year. You're going to learn a lot. You're going to help a lot of patients, and you're going to continue to grow and advance in your career. Never be afraid to ask questions. Everybody's here for you. We're all part of one team. Make sure you take care of yourself, maintain your hobbies, pursue virtual education, and make online connections through social media platforms. This can be very helpful, especially during the times of COVID. I spent most of my time interacting with colleagues around the nation, sharing cases, thoughts. It did help us all go through the pandemic together. We look forward to seeing you this weekend for the CV Bootcamp, so you can join us live on Saturday and Sunday and learn the basics about the different aspects of cardiology. Thank you for tuning in with us today. Have a good night.